Hi and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. In today's video we're going to be focusing on Other Specified Dissociative Disorder or OSDD. I'm going to be talking about the importance of listening. Now this is a really important topic, and it's especially true for people who might be newly diagnosed with OSDD or in the early stages of just realization that that's actually what they've got. Or possibly in the early stages of therapy for OSDD. What it means is that the majority of information that can be gathered about the OSDD is internal. So as opposed to dissociative identity disorder, DID, which a lot of it is quite on the outside and is observable, OSDD is a lot more hidden, it's a lot more harder to decipher, certainly from the outside perspective. Let's say myself as a therapist looking in, it's much harder to be able to work out what's going on. So both the therapist and the person with OSDD rely a great deal more on being able to navigate internal communication. And by internal communication, I mean verbal things, so actually statements, things being said and things being delivered, like verbally on the inside. It could be emotions that are being shared, or it could be sensory experience, such as physical stuff, so things like hunger or pain or disgust or discomfort. Need to go to the toilet, or nausea. I mean, there's a great list of these things. And these are all tools by which the internal system of OSDD can utilize to be able to connect with the person seemingly on the outside world. And if we're working on the basis that there's kind of a host on the outside that's sort of apparently normal, the one who gets the organization of every day done, and then there's all the other stuff that's going on the inside, and there needs to be a communication channel between the two. And in the early stages of diagnosis or treatment, often that communication channel is really not very good. What that can lead to is that the person really just doesn't either understand the signals and has a tendency to either avoid anything that's uncomfortable, or has a sort of a phobic push away of trying to get rid of any sensory experience or any words or any feelings that might be not tolerated. And emotions for dissociative folks are often extremely overwhelming, and when the person starts opening up to the inside and starts having a sense that this inside world exists, what can happen is almost like a tidal wave of emotions that sort of like thrust towards the outside, and that can be overwhelming, and it can lead to sort of an inevitable wanting to shut it all away, close it off, dismiss it, avoid it, what we call like a sort of a phobic response to this sensory experience. And what it can mean is that the person then is sort of lacking some of the self-care. So they may not eat properly, they may not drink properly, they may not go to the toilet in the right way. There's just general sense of not being looked after and not looking after the self, and not listening and looking after the inside. These are often inevitable consequences of childhood trauma. So built into the OSDD is the sort of that fabric of trauma right from the start. What can happen then is if there isn't a skill in listening, if there isn't a knowledge of how to do it, or how to decode or interpret the messages that are coming through, because remember, a lot of it certainly may not be verbal to start with, so it might not come across in word format. It could be lots of this other stuff which can be very, very difficult to pick up and understand. So without that taking place, then what happens is that disconnect between the person on the outside and the sort of the lived experience in the internal world remains disconnected. So those two things are separated by the dissociation. The trauma separates them, dissociation keeps them apart, and then the lack of being able to listen or knowing how to decode the information keeps them apart. So it's a stuck system. We talk about this being one of those closed loops. And when in therapy, let's say, and this is something that is absolutely recommended therapy, certainly for people that are newly diagnosed with OSDD, to sort of learn the steps to how to move forward, what we do is try and we build what's called an empathic attunement. So this is a type of listening which is very much a two-way process. So it's not just listening from an outsider point of view, like, just sort of listening in the headphones. It's sort of listening and making it clear that the person is listening. So an example of this, let's say, is when distress is being felt on the inside. In the early stages of diagnosis or treatment, that distress is often pushed away and it's avoided, it's not tolerated. There's no connection, so there's no attunement to that distress because it's so awful to experience, and it can be held for years and years and years and then suddenly dumped in one big go, and that can make it very overwhelming. What we try and recommend and advise is this sense of attunement, which is, I can hear your distress. I can feel your distress. I can't do anything about it, but I want you to know that I experience it alongside you, that I have this connection now. I can listen to the words that you're using, even though those words are emotional in the tone and the content in which they're being expressed. So the message is sent back in is this, basically what it's saying is, I'm trying. I can't do much about it because I don't know how, but I am trying, and I want you to know that you're not on your own. And that starts building this empathic attunement. So it's sending back this sense of it. I can tell how hard this is. I can feel how difficult this is, and I'm there with you. I have that sense now. And when that connection starts to be made, what it does is that reassurance and that sort of caregiving, that nurturing sense of, I'm going to try and do something about it, I'm going to try and help, starts being passed back through the system. So we then have more of a two-way system where a communication is coming from the inside, it's being heard on the outside, and a reflection of empathy and care and interest is being passed back into that system, and that takes away that closed loop and it allows it to be much more of a to and fro open communicative process. This is extremely difficult, and just being able to start tuning in can be distressing in of itself if there are no rules, if there are no boundaries, and it's not structured in any way, which it often isn't when people just start going at it on their own. And a therapist who knows what they're doing with dissociation can really help with the containment of this, manage those boundaries, set some rules about the flow of information, the volume, the intensity, the duration, all of those kind of things, all of which make it a lot simpler and easier for the person to be able to start listening without being overwhelmed. So I hope that's an interesting video. So for the folks with OSDD, this might be something that you can start having a look at and working out how good you are at listening and noticing these things, and what kind of communication is the best stuff that you might be able to pick up. Is it the verbal, is it the physical, sensory experience, or is it the emotional? And where are your sort of vulnerabilities for that? And this is all to be taken into and shared in therapy settings. And I really hope that you have those available to you. So please leave any comments about this. It's always really nice to sort of focus in on one particular thing and offer some help and some insights, all of which we've picked up in the clinical work and the knowledge that we carry into the work that we do. And this is the stuff that we talk about with the patients in our clinic all the time about how to do these things. So I hope it's of use to you. Please do all the usual liking, subscribing, sharing and all that sort of stuff, because it always just does help. And please leave comments at the end of the video and we'll keep making the videos for you. So in between now and the next video, please do take great care.